Yeah, that's very important to consider, definitely.
Mm.
Um, and was there any like certain experience in your career that changed your mindset or just like stuck to you even to this day about the impact that you made with your patients or about in your job especially? Any certain experience?
Um, yeah. I mean, there's a
If you
lot.
know
There's small experiences. There's no, go ahead. What did you say?
if you're not comfortable sharing a certain experience, that's completely fine, but um, go ahead.
Oh no, I hear you. Okay. Um, yeah, no. So I I really get a lot of joy from the small wins with patients because I think the little small wins are what add up. So like it can be very satisfying to me to for someone to come in for the first time and have just like totally uncontrolled diabetes and they're scared and they know family members who've lost their feet to diabetes or had to go on
Mm,
dialysis or whatever and um they come in very afraid of this
yeah,
just feeling like they don't have control over their health and then to walk them through a plan and educate them and encourage them and then to see them just even 3 months later and their blood sugars have gotten way better just from starting a medication, changing their diet. The It's a huge mind shift. You see this like it's very empowering to the patient to know that
mhm,
um they can regain control of their health, and I love those moments. So those type of moments are probably my favorite. I think learning about direct primary care was very significant in my life because it
mm,
completely changed my outlook of what my future was going to look like as a family medicine physician. Because I love family medicine, but even as I was going through the training, I kind of would hear or and experience kind of this like the downsides that I mentioned before. And when
mhm.
I learned about this model and was like, wow, there's like another way to do primary care, that was life changing for me.
That is very inspirational. Wow. Um, and speaking of which, was there like any characteristics that you would describe a person would have for this job? Like any, like what kind of person would you recommend this like career field for?
Sure. I would say you'd have to be comfortable talking to people. Um, you know, you don't necessarily need to be outgoing, but you should be someone who enjoys building relationships because I think at the end of the day, the primary care doctor is going to be that every person's, the doctor they think of when something goes wrong. And so you want to be able to have a good relationship with your patients where they feel comfortable reaching out to you for whatever it is that they might need. So, um, yeah, as someone who is comfortable being around people, having conversations with people, someone who has a lot of interests, meaning like if you're someone who just loves to learn a little bit of everything, then family medicine is for you. If you're someone who likes to
Mm,
be the expert in one thing and just be known as that guy, family medicine is not for you. And there are many other ways to do that, and the people who do that are awesome at it. But it's not that field. It's not that field to be the expert in one thing.
mm,
Also, family medicine in general is not very procedure heavy. I mean, we do some office based procedures and some stuff with our hands. But if you're someone who, like, really likes to work with their hands and really likes to just, um, you know, just more hands-on people, I
mhm.
feel like family medicine may not also be that person. I would say family medicine is more of a, I don't wanna say intellectually based because 'cause they're all intellectually based, but just, you're using reasoning more than you are using your hands.
Oh, very cool. And lastly, are there any particular tips for high schoolers in general to be a medical professional in general, or just like
Yes.
yeah, go ahead.
Yeah, so for high school, um, there is so many opportunities and so much ahead of you that it can be so exciting to explore. So I guess my biggest thing for high schoolers is, as a high school student, you can do a little bit of learning about medicine or health, any health
Mhm,
profession. Um, but I would just say go into college just open-minded. Even go through high school open-minded, meaning, yeah, you can find your experiences related to that career that you want to do, but I wouldn't only focus on that because you never know what could pique your interest. And maybe it's not medicine. And medicine is a lifelong commitment and it is a very tiring process. So I always tell people when they're at the start of that trajectory, really make sure it's something you want to pursue. And if you start, going down the medical path 1 or 2 years into it and you're just like, I'm really not feeling this, just step away. Don't waste your time doing something that doesn't bring you joy. So, the only way you can find if it is the thing that brings you joy is by experiencing other things outside of medicine to know that, hey, this really is what I want to do. Like nothing else makes me happier than when I'm, you know, around other doctors or when I'm in a hospital or when I'm in clinics or when I'm talking to patients or when I think about taking care of people. So yeah, having a very open mind. When you do go to college, take other classes. I was personally kind of against being like a very traditional just biology major because I thought that would what get me into medical school. And I think having taken other classes, I took philosophy and linguistics, and that was all part of my major. It I think it made me a more interesting applicant, and it just made me a more well-rounded individual in the long run. So, you have your whole life to become, to be experts in science and medicine. I wouldn't spend those first few years when it's kind of like your only chance to explore other things and just learn other things for the fun of it. Take a class every semester in college that's not related to your major and not related to being pre-med and just do it just to do it because you're never going to get a chance to do it again. Um, that's kind of like my starting advice for um, at the high school level and kind of the entry into college level.
that's really interesting. Yeah, I guess it's
That's
important to have a
great.
mix.
I think that all of our oh, sorry. Yeah, sorry. I was just saying, yeah, that's really great. And I think that's all of our planned questions. I just had one last question. Um, so how would you say like balancing the like work-life balance between being a medical professional and like owning your clinic, but also having a family is? Because I know a lot of students might be like a little apprehensive to go into medicine because like that stereotype you need to work all the time.
Mhm, mhm.
Yeah.
Yeah, that was a very, big deal to me that I never wanted to sacrifice, the other parts of my life that are very important to me for my career. And what was important to me was my family. Um, and that was both, like my parents, my personal family, but also I got married in medical school. I had my first baby in medical school. I had my second baby in residency. So um, I had a lot of personal life going and happening throughout medical training. And the way that I approached it was I treated school like a job. And that means, it wasn't always like 8 to 5, but I had set hours during the day where when I was there, I was focused on that, on learning, on being at school, being present there. But after those hours, you know, undergrad was a little hard because you kind of, your schedule is not so set. But even in medical school, like after a certain hour, if I didn't have an upcoming exam or something really important that I needed to spend more hours studying, I, you know, I turned off the medicine side of me and I just, I worked out or I went to movies or I went to, spend time with my family. And I think it's really important to have time boundaries because it can be very easy to just get sucked into I need to study 24/7, 365. Um, and that's very detrimental to your to your health and
Mhm.
your ability to succeed. I mean, if you burn out, how are you gonna move forward. So you need to like pace yourself. As you know, a female in medicine, there was always that like, how are you gonna be a mom or be the kind of mom you want to be? And I am the kind of mom I want to be. I mean, this is the mom I want to be. I want to be the mom that works and is a doctor, but also is there for my kids. And I make it happen because it's a priority to me to make it to happen. And like I said, when I found direct primary care, it fit that picture of what I wanted my life to look like. Um, and same with even just choosing family medicine in general. You know, I knew I never wanted to be a surgeon. For one, don't like surgery. I mean, that's the most obvious, but also I didn't like that lifestyle. I was not someone who was going to be happy having to be on call crazy hours of the day and at night and on weekends. I just knew I didn't want that in my life. And I knew I wanted to have moments dedicated to my family. So I chose a specialty where I knew I could get that. So I kind of even, and I wasn't even married when I started medical school, but I already knew that that was the life I wanted. I mean, that was just I pictured it. So uh, balance is a hard word because there's always going to be moments where you're going to be off balance, and that's okay too. I think you learn that you might go through waves in your training or your education that you really do have to focus on just one thing. So if you have finals coming up, like, yeah, okay, for the next few days or weeks, your life might just be all about finals, and that's okay. And that's still balance because you are um, working towards a goal that you know in the long run is going to benefit you and be personally satisfying. But you scale it back when you're done with that intense period. Then you scale it back, and then you put the attention back to your family. Um, so it's
Yeah.
yeah, work-life balance is kind of it's an interesting topic.
That's great. Yeah, I'm glad that there is a balance.
Yeah.
Okay, so now that's all the questions we have for today. Thank you so much once again for joining our podcast. You're like really helping us get the message out, and you're our first and only family medicine doctor we have so far. So
Oh,
that's
well, I
really
hope
great.
we have many more. Thank you guys so much for talking to me. And I think, what you guys are doing is really great. I think starting from the high school level of figuring out, what is this career all about is so important because a lot of people go into medicine and really have no idea what they got themselves into and they feel like it's too late. And so I really respect what you guys are doing and I will spread the word about your podcast.